our understanding of potential climate futures. So please join me in warmly welcoming Dr. Ebi to the Dorset School.
Well, thank you very much. I really appreciate all of you coming. Look forward to doing something in person for a change. It's been a while for all of us. So thank you. I appreciate you bringing me here. And I wanted to start by saying my time is for you. That I put together slides. I'm an academic now, so we do that. We put together slides. I am not committed to going through all my slides. I'm not committed to going through any proportion of my slides. I'm really happy to take questions as we go along. This is a huge, huge field, and there's so much to cover. And I've chosen some aspects to highlight. Doesn't mean they're the most important. I just thought perhaps they would be of interest. But please stop me as we go along if you've got questions. And we will make sure that we have a discussion, which is going to be the most entertaining part. Thank you. Thank you. I want to start over on this side and talk a little bit about thinking about the future. The future is inherently uncertain. It does present quite a lot of challenges for people who work in population health. We want everything to be evidence-based. I don't have good evidence for what the next year is going to look like. COVID really illustrated how little we know about what the future could look like. And so when we think about climate change in health, we're thinking going forward about risks. Risks are probability times consequence. And when you break this down, and this is the framing used by the Intergovernmental Panel on Climate Change, is risk is composed of three main factors. I'll name four. The first are the hazards created by a changing climate. The second are who or what are exposed to those hazards. You can have the exposure, you can have the hazard, but not the exposure. And there's been a tendency in population health to conflate the hazard and the exposure, and we have to keep those separate. And the third are the underlying vulnerabilities. We're included in the underlying vulnerabilities of the susceptibilities and the capacity to manage. And so other groups have used a four-pronged Heller diagram. But this is the basic framing that we use. We're looking at risk management. And think about how climate change affects our health. Can't reach up quite that high. So we've got increasing levels of carbon dioxide, short-lived climate pollutants, of course, are raising our temperatures, resulting in more and more extreme weather and climate events. And we have rising sea levels. Those are just some of the things that are changing. But it's not just the hazards created by changing climate, it's how those hazards interact with a very long list of demographic, environmental, socioeconomic, and other factors. And so, as somebody's worked in this field for a long time, we're constantly accused, you only look at climate change. We don't. We have to look at everything else that is changing. And importantly, we have to look at these interactions and what these interactions mean. These interactions affect the exposure pathways with which you're all familiar. So you understand all of these exposure pathways. I've spent today talking with people who work on various exposure pathways. This is a short list of climate-sensitive health outcomes. It's a short list, but it's a very long list. I spend a lot of time working in low and middle income countries. It's everything that a Ministry of Health deals with. I strongly believe that climate change is going to be one of the factors that's going to fundamentally shift how we do population health. There are line departments and ministries that look at maternal and child health, that look at extreme weather and climate events, disasters, that look at, oh, I don't know, Vibrio parahemolyticus. There's all kinds of factors that are looked at, but climate change cuts across all of them. And so one of the challenges I see in working in countries is that you've got all these stovepipes. The climate change cuts across all of them. And so we are going to need to think differently about how we address these problems when they're all interconnected. And we all know that they're interconnected with each other. We know that diarrheal diseases increases the incidence of undernutrition, that we shouldn't be treating these as separately, although we do. And so we're talking about systems-based approaches because we're fundamentally shifting the Earth system. So where's it? It's stuck. See, and it's the little thingy here isn't working.
I'll try.
All right, so the next is a photograph I took, you'll see it eventually, of children in parts of West Africa. About 85% of the health risks of a changing climate are in children. In the US, when you say climate change, everybody thinks about polar bears. Polar bears are having lots of trouble. I want you to think about children as well, because they're the ones who are being affected now and will be affected throughout their life course. And one point I hope you take away from this is that you think about not only children, but think about yourself. My future is going to look a lot different because of climate change. My future self is going to experience different weather patterns than what I'm experiencing today. So we need to think about these life course consequences. Look at that, fantastic. Perfect. Children. All right.
Maybe you're just.
Maybe it's gonna work now. What?
Just stay.
It's got too many words on it, I know that. And this is the conclusion from the Intergovernmental Panel on Climate Change report that was released at the end of February. The Intergovernmental Panel on Climate Change, the IPCC, has 3 main reports in each assessment cycle. The second report is on impacts and adaptation, called Working Group 2. There's very strong conclusions from this report. Climate change is killing people today. Not a future issue, it's happening now. And I highlighted in this lighter blue color, again, this is just a list of some of the issues that are of concern with climate change and health. Obviously, underneath all of these is a long list of vector-borne diseases and other issues. And this gives the confidence in the key findings around these. And the IPCC report is a little bit dense, but it's not impossible to read. And I'm going to run through some of these and talk about some of the health outcomes. Again, happy for interruptions, questions, clarifications. NOAA, National Oceanographic and Atmospheric Administration, tracks billion-dollar disasters in the US. So every year they put out this list of billion-dollar disasters. I always download this because I never can come up with all of the disasters that were more than $1 billion. I'd forget them. And I work in this field and I forget them. And these are the billion-dollar disasters. And these are primarily insured losses. They don't include health. They don't have the uninsured losses. And these are not the $100 million disasters, the $10 million disasters, the $1 million disasters. So this is where infrastructure was heavily impacted by an event. And this is just through September of last year. It's about 20, this is 18, I think the total was 23. And I forgot the exact number, but the total impact on these insured losses for the US was close to $50 billion. So when people say we can't afford to address climate change, we can't keep paying $50 billion a year for the large losses. And then there's losses underneath it, of course. Climate change is expensive. You know the consequences of having an extreme flooding event, for example, and I like to include growing emphasis on mental health issues. Also, this is great research done by Public Health England. They've changed their name after they did this, got the newest one. But the point before about separating exposure from the hazard. And you can see the difference in mental health problems between the flood disrupted and not flooded. This cohort's been followed for 3, and I think they're into the 4th year of follow-up from this flooding event. And the prevalence has come down, but it's still different across the 3 groups. The mental health consequences of these extreme events is quite high. And this is only in the high income countries that we have some good data. And of course, there are many very severe impacts in low and middle income countries. So the overall estimate is that the mental health consequences are quite large. And you're going to see a lot more research coming out in this area. Heat is one of the extremes. If you didn't know, July was the hottest month ever on Earth. Ever's a really long time. There are data back to the mid-1800s. Starting in the mid-1800s, humans started putting out thermometers, rain gauges. And so we've got data from the mid-1800s. It's always been amusing to go into meetings with people from National Meteorological Services when they start complaining about how they don't have enough data. They only had 80 years of data. And I say, I've got 3. But this just gives you a sense of where records were broken. And that's a lot of places to break records. These are not covered in our media. Heat matters because people die from the heat. Almost all of the deaths are preventable. No one needs to die in a heat wave. And this is a nice figure put together by colleagues at the University of Sydney looking at the physiological pathway. Our bodies have lots of mechanisms to keep our core body temperature, which is what we're concerned about, is our core body temperature. Keep our core body temperature within a pretty narrow range. Our core body temperature gets too high and we sit in a room that's hotter than it would be in April because it's 80 degrees outside, our core body temperature starts to rise. And people have all kinds of mechanisms to try and get that heat out. If you're outside, you go sit in the shade. So we do activities, our body motivates us to try and keep that core body temperature down. If we can't keep it down, eventually, of course, we all sweat because that's a great mechanism to keep the core body temperature down. And if our external actions, the actions of our body are insufficient, we go into heat stress. There's thousands of ways we can help people keep their core body temperature down. This is why nobody needs to die in a heat wave. And you can see on the right, as the core body temperature goes up, our cells and our organs start being affected. Our heart, our lungs, our kidneys. When you look after a heat wave, about 50% of the deaths are from cardiovascular disease. These are people who would not have died of heart attack without the heat wave. Exposure to heat waves are going up. This is from the Lancet Countdown, which I thought I put down there, but I forgot. So it's the Lancet Countdown, older adults under the age of 1, and you can see this really dramatic increase in exposure. And you can read the numbers. For older adults, 3.1 billion more person days of heat wave exposure in 2020 than the long-term average. So significant increase in exposure to heat waves. We know from the Working Group 1 assessment on the physical science that heat waves are increasing in frequency, intensity, and duration. And that's why you see a lot of focus on heat. I live in Seattle, marked conveniently on the map. We had a heat dome. It was not $1 billion disaster. We had 3-4 days where temperatures were more than 10 degrees Fahrenheit above the last record. If you think locally, if you follow the weather, you'll see, oh, we're going to break the record today. It's going to be 1/10 of a degree higher than normal. More than 10 degrees higher than normal. We had temperatures well over 100 degrees. Our nighttime temperature was 80. About half of Seattle has air conditioning. It's a long-running puzzle of why the city that's built on technology has drawn the line at air conditioning. We don't do air conditioning. People slept on, my colleagues slept on roofs. They slept in basements. They slept in backyards. But it was 80 degrees. And if you can't cool your body down at night, then that heat builds up. And what happened in this region was typical of what happens in every unprepared region. Mortality starts in about 24 hours. So the first 24 hours look pretty good, right? We're doing okay. We don't have a heat wave early warning system. We're going to set up some cooling centers. We're going to do some stuff to try and help protect the population. After 24 hours, one of our emergency departments sent a text message to the emergency department that coordinates all of our emergency departments and said, we're in crisis. We had a 69-fold increase in hospitalizations. An EMT burnt his knees, kneeling on a sidewalk to help somebody who collapsed. They're trying to figure out how to keep people's core body temperature, bring it back to normal. So this is a visual image for you. People were brought into the emergency department, very high core body temperatures, and they were put into body bags with ice. And it was really effective. I don't think I want to be zipped into a body bag, but it was really effective. One of the emergency departments almost ran out of ice. It was a crisis situation in the middle of COVID. Between the state of Washington, Oregon, and British Columbia, the preliminary estimate, because the studies aren't finished, is more than 1,000 people died. These are 1,000 people who would not have died without that heat wave. The numbers are dramatic. There was heat waves, 2 heat waves in Europe in 2003. There were 70,000 excess deaths. 2010, a heat wave around Moscow, 50,000 excess deaths. Heat kills. And I'm talking from the health perspective, heat is an all of society issue. This heat dome occurred during our cherry season. We're one of 3 states that has regulations to protect outdoor workers in the heat. Saw stories of orchards, apparently part of the picking process, about which I know nothing, is part of it involves going into a cooler. And so they changed the whole process so everybody spent time in that refrigerator to get their core body temperature back down. It also happened when our wheat was planted, so our wheat was really effective. The heat dome was during low tide, and so when you look along the coast, there was something like 1 million mussels and clams that were cooked, which is food security and livelihoods for many coastal tribes. So when we think about what we need to do, these are all of society problems, and everybody needs to be at the table to be able to effectively address them. There is a formal process that was done for the heat dome called detection and attribution. It's a formal method for determining how much of an extreme event could be attributable to climate change. The consensus on the work that was done for the heat dome is that heat dome was virtually impossible without climate change. Anna Vacedo and colleagues have a big database that they use. They looked at over 700 locations in over 43 countries, linked it with a detection and attribution study done by the climatologists. These are the results that overall, over about a 20-year period, varied from country to country, about 40% of all heat-related mortality can be attributable to climate change. We can start counting the number of people who are dying from climate change. And that moves health policymakers at least. And you can see very high variability across the countries, but you can see how important heat is everywhere. I'm in the Pacific Northwest. As soon as I talk about heat, I think about wildfires. And so this is also from the Lancet Countdown, somehow also lost that legend down there. And you can see increase in the number of exposures to wildfire smoke. Very large increase. We know that with hotter years, there's higher wildfire risk. This is just for the Western US. Lots of variability, very clear trend. Many of you are doing research that looks at particulate matter and what the adverse health consequences are of exposure to particulate matter. So these are just 3: diabetes, lung disease, and heart disease. But I put this in because you can see for the air quality index, when you get up towards 60, it's unhealthy for everybody to breathe. In my neighborhood 2 years ago, We had all kinds of wildfire smoke blowing in. Our skies were yellow, solid yellow for 2 weeks. And the air quality index in my neighborhood was 250. This last summer, there was a big wildfire around Los Angeles. The air quality index was over 700. And as you know, PM is just a particle size. And it looks like the toxicity of wildfire smoke is higher than just the particle size. So massive exposures are being experienced right now from wildfire smoke. A really helpful, interesting piece of work was just published from British Columbia. And this is the first of 3 slides about the results. And this shows extreme heat exposure. And they broke apart thinking about indicators for heat into who's exposed across British Columbia, who's sensitive, what does the demographic structure look like, what proportion of the population has chronic disease, and how capable are the communities to be able to manage when they have a heat wave. So they developed these indicators and did this not just for heat, but also did it for flooding and sea level, for wildfire smoke and ozone. Ozone's formed on clear cloudless days. The rate it's formed is temperature dependent. All else being equal with climate change, more ozone. And then, quite helpfully, they put it all together. These are the places where it's urgent and immediate that they need to start addressing these changes in extreme events in British Columbia. This kind of vulnerability mapping is occurring in more and more places. And again, from multiple kinds of exposures, looking at how capable communities are, how vulnerable the population is, to make sure that you can prioritize where you're going to spend money to address the risks. How many of you have allergies? It's usually a third. Wow. What is it about this region that everybody's got allergies? Yeah, ragweed season. You can see up until Alberta, more than a month longer, ragweed season. Starts sooner, lasts later into the year. I'll talk more about carbon dioxide itself. Carbon dioxide is leading to more pollen. So longer season, more pollen. And you can see poison ivy, that as we have warmer temperatures and more carbon dioxide, more toxic oils. So anybody who's working in allergies and those kinds of issues, you've got a lot of work ahead of you. The IPCC also looked at projected impacts. Several of you spoke with me today. I talked at quite length about how there is no research funding in this field, but we do have some projections. And these are the places where there's sufficient projections to be able to talk across the projections about what we're seeing in terms of what could happen with climate change. And again, there's levels of confidence associated with these. These don't mean they're the most important. It's where there's been research money. There's a lot of research on heat. So most of the research right now is focused on heat. And that's because that's where the funders want to put the money at the moment. And for all of these, basically, they're all going to increase with climate change. Vector-borne diseases are changing their geographic range, their seasonality, their intensity of transmission. Just talk about extreme events, food and waterborne diseases. So many of the pathogens replicate at a rate which is dependent on the temperature. Warmer water, faster replication. They're pretty straightforward. The question is, what are we going to do to prepare for them? And then I mentioned mental health earlier. This is one of many examples of projections. I like this from Drew Schindel, because the top row is projecting heat-related mortality with adaptation to changes in the temperature, assuming that we start acclimatizing, assuming we make some changes so that we can adapt. The bottom is no adaptation. The left is business as usual in terms of greenhouse gas emissions. The middle is modest reductions. The far right is very aggressive reductions. you can see real differences in terms of what happens with mitigation, what happens with adaptation. And I need to point out that when you look at these projections at the end of the century, that no matter what we do, they all show increases in heat-related mortality. We're going to have what we call residual risk. We can't mitigate and adapt sufficiently to reduce all of the risks of climate change. Yeah.
Can you clarify the difference between an adaptation and reduction? I just don't understand the two.
In our field, we have two policy levers. There's adaptation, which is getting ready for and managing change. We have mitigation, which is reducing greenhouse gas emissions. And so emission reduction is talking about reducing our greenhouse gas emissions. It's challenging because done a lot of work in disaster risk management, and they talk about mitigation, but they mean something completely different. So as you go into this field, one of the issues always is, how do we talk to each other? We use the same words, and they don't mean the same thing. My favorite story on that was I think it was the late 90s, early 2000s. There was a workshop on climate change and health at a facility in Cape Cod. And we brought together some people in meteorology and climatology, and we brought together health people. Spent a lot of time on the agenda. And the first speaker, well-known entomologist, to talk about vector-borne diseases and why temperature matters, because, changing the geographic range, those kinds of issues. So he's all set up to talk. And the organizing committee is standing around, and a meteorologist, well-known meteorologist, comes up holding the agenda and said, "I'm so glad to see that you health people are going to finally talk about something we know about in meteorology. Diseases born on the wind." Because in meteorology, the direction of the wind is a vector, right? And so saw the word vector and assumed that's what we're talking about. So for years, we had a slide with an arrow and a mosquito. They're both vectors. And we do need to do a lot of work to have that communication and make sure that we are effectively talking with each other about what we need. And so when you look at IPCC reports, what you don't know is there is a glossary, and hundreds of hours have gone into that glossary. And making sure that glossary is consistent across the working groups so that we use the same language and so we communicate clearly when we talk about things. But yeah, it's a significant issue. I'm glad you asked it. So anyway, you can see we're going to have residual risk no matter what. And also this gives you the motivation for both adaptation and for mitigation. Are there other questions? Everything completely clear? Moving on to everybody's favorite topic, vector-borne diseases. I put this in because, of course, the mosquito has to be Betty because it's only the female mosquitoes that bite. They need the protein in the blood to be able to lay their eggs. I'm not going to go through all of this. This is from colleague Corey Morin. And I put it in here to make the point. You see temperature and precipitation affect the development, survival, and reproduction of mosquitoes. It's also true for many other vectors, and affect the replication and transmission of the pathogen. And so modeling this is pretty complicated because you have to model what's happening to the vector, and you have to model what happens to the pathogen. And so you'll see, for example, talked earlier today, in many places, projections in some regions of Africa are a reduction in malaria because it becomes too hot and too dry for anopheles. At the same time, Aedes is just going to continue to increase its geographic range. So you have to look at this intersection of both to be able to do any kind of projections for what could happen in the future. Here's one that was done several years ago, looking at Aedes aegypti, which can carry dengue, chikungunya, Zika, yellow fever. These are modeled data because, as you know, all the vector control in the US is at the state level. It's not a national activity. So there's real discrepancies between states and what they do in terms of vector control. This is where is the climate suitable, based on lots of research that's been done. The beige area is where in the US is the climate suitable for this mosquito. Doesn't mean we're looking for it. We may not know it's there, but we've got the right kind of climate. And the projections are for the end of the century under high greenhouse gas emissions of where could the mosquito move to, including Seattle. And so you can see a huge expansion in the geographic range. But it's not just having the mosquito there. You have to have a summer that's hot enough and long enough that if you introduce dengue into the mosquito population, that you can then have transmission of dengue. And so this is what happens when you look at suitability. So much constrained range for where you could actually have transmission of dengue. And thankfully for us in Seattle, we don't have to worry about having transmission of dengue by the end of the century. Still a pretty significant expansion in the Mid-East, in the Southeast. And just like every other field in climate science, we're under projected change. So this came out 2016, 2017, breeding colonies of Aedes aegypti were found in Toronto, Toledo, and Detroit. That's outside much of the suitability. And once Aedes there's breeding colonies. Once you've got breeding colonies, it's essentially impossible to get rid of it. It is 100% adapted to the human environment. I have not done this. I will not do this. But entomologist friends of mine say if you go into sewer systems, there's millions of mosquitoes. It's warm, it's moist, there's rates for them to come and go, to get their blood meals. It's a perfect environment. And so we know there's been studies, we know in many cities in the US, Aedes is just overwintering in the sewer systems. So once you've got it, you can't get rid of it. The biggest health risk of changing climate is going to be undernutrition for two main reasons. The first is temperature is affecting, and this is a brand new figure from the IPCC, maize, rice, and wheat. Soybean is weird. So we're not going to look at soybean because it's a legume anyway. We're not going to look at that. And you can see these projections for mid-century, end of century, the numbers of the number of models under 3 different visions of greenhouse gas emissions, and all of them show a decline. What this doesn't show is that the decline is primarily in tropical regions. There was a decrease in the number of people who were food insecure as measured by FAO, Food and Agriculture Organization, and that decreased for quite a few years until around 600 million. And it's growing again. It's back up to, I think, about 800 million people in the world are food insecure. And so the projections are just less crop yields in the places that are growing the fastest and are going to need the crops the most. So all of the projections suggest food security is going to be an issue. The few health projections translate this directly to big increases in stunting. Not many projections around wasting, it's more challenging, but the stunting, very clear increase in the prevalence of stunting. The other mechanism is carbon dioxide itself. All of our plants have mechanisms to pull in carbon dioxide from the atmosphere and through the photosynthetic pathway, break that apart into carbon and oxygen. The plants use the carbon to grow. Based on the biochemical characteristics of those pathways, there's 2 main pathways. 85% of our plants use one particular photosynthetic pathway to do this. And based on the characteristics of that pathway, these are called C3 crops or C3 plants. And so when you look at C3 plants, there's a number of experiments where somebody has a field, it's usually wheat or rice, you divide it into plots, some of them you blow carbon dioxide over. The concentration of carbon dioxide is what's expected later this century. So quite a few field experiments. And what you see is, what you read a lot is that CO2 is plant food. It's true, plants grow. But you're changing the internal balance within the plant between carbon and nitrogen. You're putting more carbon into the plant, which is reducing nitrogen. So any nitrogen-based compound like protein and B vitamins decline. And you can see those are pretty big declines. There's another mechanism for the C3 plants. When they have higher carbon dioxide, they're more water efficient. So they bring in less water from the soil. They don't need as much. And that means less micronutrients. 5% reduction of micronutrients. I mentioned about 800 million people in the world are food insecure. 2 billion have micronutrient deficiencies. Hundreds of millions on the edge. We're talking about iron and zinc. 1.5 billion women and girls have iron deficiency anemia. So these pathways are critically important. The estimates, there's been a number of estimates. I was involved in one study looking just at rice, just looking at the poorest rice-dependent countries in the world. And we estimated 600 million people could be affected. So the consequence, and this was looking at climate change. This is just looking at CO2. So really large consequences. At the same time, you've got more carbohydrates. So when people eat the same amount of food, they're getting more starch. And you can think about the contributions then to obesity, because people are not getting the nutrient-dense food that they need. I know this is quite heavy, so to lighten the mood a little bit, this affects the entire plant. So one thing that's been highly entertaining my students, and I learned this from somebody else, full disclosure, I didn't figure this out. So one of the compounds in plants that is a carbon-based molecule that increases under CO2 is the active ingredient in marijuana. And the marijuana growers apparently know this, and they've been growing marijuana for years under higher CO2 concentrations. And apparently the concentrations in marijuana today are tenfold what they were in the 70s. So when parents talk to their kids about smoking marijuana, they're talking about two very different things. And so there's lots of changes. So plants are changing in many different ways. I'm talking, of course, about health, but it's not just us. It's also animals. There's studies coming out of US cattle that are grass-fed. Grass is a C3 plant, of being increasingly stressed. And the hypothesis is they're not getting the nutrition they need from the grass, which then feeds back to health. Because I don't know how many times you've heard, but I keep hearing about, you got iron deficiency, just eat some red meat. Where do you think the iron comes from? So there's lots of work that needs to be done in this space to better understand the magnitude and challenges of the problem. This is one projection that looked at dietary availability of protein, iron, and zinc with some positive and some negative influences in 2050. And look at the declines in the global availability. Again, these are really large numbers. It's going to be a significant area of research, trying to get more of the research funders to pay attention to this, because we need all hands on deck to figure out what we can do to really affect the changes in the nutrient density of our food.
So is this thing being linked, or has it been linked with obesity research, or is that starting to?
Nobody's looked at it yet, but it makes sense
Right.
that it does, because yeah, I gave a TED talk and I got all of these comments, which were just fascinating, yes. And all these people who said, oh, I just eat more. Like, I know. I just, no, that's not gonna do it. I've got a few more slides. I'm gonna try and get through the next few minutes. This next point is about every emission matters. And this is from the new Working Group 1 report, historic warming, which is showing warming under different combinations of greenhouse gas emissions. And just there's a linear increase. Every emission makes a difference. On the other hand, because every emission makes a difference, everything we do to reduce those emissions makes a difference. So every action matters, and every inaction matters as well. But I put this in here because I want to talk about some figures that have been iconic in the IPCC since 2001. So here you can see the projections of temperature change. And these figures here go back to the United Nations Framework Convention on Climate Change itself. Article 2 of the convention states that the purpose of the convention is to prevent dangerous anthropogenic interference with the climate system. That was signed off on by all the negotiators across all the countries. Great. How do you define dangerous? Personally, I won't go skydiving. right? I think that's just something I think is far too dangerous to do. And so I'm making a joke of it, but it's real serious. How do you define dangerous? So in the third assessment report of the IPCC, which came out in 2001, there's a chapter that took on this question of what's a dangerous anthropogenic interference with the climate system. And they came up with 5 reasons for concern, RFC, reasons for concern. The first is unique and threatened systems. There's already ecosystems in the southwest of the US that are labeled functionally extinct. There's cloud forests that will not survive. There's nowhere for them to go. You think about our coral reefs, and I'll talk about those in a moment. The second is extreme weather and climate events. I don't think I need to cover that. Back in 2001, that was an issue for people to talk about. The third is around the distribution of impacts. It gets to the inequities, small island developing states and the challenges they face. The fourth is the global aggregate impacts, adding it all up. And the fifth is large-scale singular events. This is melting of the West Antarctic ice sheet, basically. And from a complete assessment of the literature, developed these figures, which because of the color scheme, we all call them burning embers. That's what they look like. The 0 line is pre-industrial temperature. The white is where scientifically we can't tell whether the system has changed. The system may not have changed. The system may have changed. We don't have a long enough data set. We can't tell. When the color turns to yellow or gold, it means that with at least medium confidence, we can say climate change is affecting that system. At red, the risks are high, and at purple, the risks are very high. The dots are the level of confidence in the transitions. When you go and do these assessments, the real question is, where is that transition from medium to high risk, from high risk to very high risk? Because that's what policymakers want to have. And so that with a long preamble, we did this for health. And so these are the burning embers. We did 6 of them. 4 of them are in the summary for policymakers in the 6th assessment report. We also did this under 3 different visions of adaptation. The left is limited adaptation. The world has high challenges to adaptation and mitigation. Medium, kind of muddle through what we're doing now, do some things well, some things we don't. And on the right is proactive adaptation. And these are truncated at the projections from Working Group 1 of temperature change in 2100. So under this particular vision of proactive adaptation, the world isn't going to go above 2 degrees C above pre-industrial. So that's why these are truncated. And hopefully when you look at this, you see 2 things. Mitigation matters. Adaptation matters as much. That this interplay between adaptation and mitigation, we want to be here. We're still going to see impacts, but we don't want to get to those very high risks. And if we can do both, if we can both mitigate and adapt, if we don't, we're going to look more in this world where we're going to end up with high risk.
What are the adaptations that are assumed?
I'll show you.
How you're showing.
I'll show you. Yeah, let me skip that and go, here you go. So here are the adaptation options in the IPCC report, starting with strengthening our health systems. But there are so many things we can do. Heat action plans. And I'll talk about that in a minute. Increase access to potable water, more surveillance, better approaches to adaptation. So there's a very long list of what we can do. And of course, we need to start doing it urgently. The major constraint, when you look under the UNFCCC, under the adaptation funds, less than 0.5% goes to health. So we're not seeing the investment that we need to have. And that's an area where there's a lot of voices talking about how we need to really increase that investment. Heat action plans have 2 major components. The heat wave early warning and response system. This is more than my broadcast meteorologist telling me Seattle was going to be really hot, which they did regularly. We have to really know what it is we do. There's also the longer term planning. City of Seattle, just like looking out from the hotel room, is a city of cranes. Buildings are constantly being rebuilt. How are we going to plan for a warmer future? Is every building going to have a white roof? Every building over a certain size is going to have a green roof? Are we going to start planting trees in all of our red line districts because they're hotter than everywhere else because of the red line process? What plans are we going to put in place? And so it's doing that longer term planning. And this is just a poster from Quebec. I put this in from Ahmedabad. It's an area of India that's really hot and really dry. It's next to Pakistan. I happened to be at the first meeting to organize developing their heat wave early warning system. And we met with one of the hospitals. And we'll just say that the hospital had some challenges during a recent heat wave. It turned out the neonatal ward was on the top floor of the hospital under a metal roof. So part of what they did was reorganize their hospital. And it just as an example, there's so many different ways that we can start thinking about organizing for a different future. And having more people thinking about how we do that is going to make our actions more effective. Similar comments with early warning systems for vector-borne diseases. This shows you the typical epidemic curve. Assume all the students are aware of the typical epidemic curve. If you have passive surveillance, the kind of difference you can make, these are just heuristics. But here's what you can do with early warning systems. There's an early warning system either implemented or close to being implemented in Singapore, has absolutely the best dengue control program in the world. Really do a lot of work to control 80s. Civil authorities can go into your residence unannounced at any time. If you have breeding sites, you get fines in the hundreds of dollars. So they really work at it. But they still have outbreaks. And so a graduate student who went to a university in Sweden started working on what could we do with early warning systems and identified some clear temperature precipitation signals for Singapore. And this early warning system gives them 4 months notice. 4 months to clean up breeding sites, 4 months to warn pregnant women, 4 months to put everything in place. And so you still might see an outbreak, but it's nowhere near as where it would be. So I have 2 minutes and I'm going to spend, so national adaptation plans, we're making some progress. Got a long way to go. So I want to make a couple of points here at the end. For those of you who don't know, the #1 emission, the #1 source of greenhouse gas emissions in the US is transportation. And I want to make the point that when you look at the major categories of mitigation, reducing exposure to coal-fired power plants, having more active transport, getting people walking and biking and out of internal combustion engines, does really significantly change their exposures. And the other is diet, of having people eat no more red meat than their doctor recommends. There's a lot of effort on the mitigation side of quantifying this and estimating how much this is going to cost. A huge lost opportunity is not looking at the health benefits of those changes. And the studies that have quantified the number of avoided hospitalizations, the number of avoided premature deaths, and then value those, economists like to value things. The value of the health benefits is of the same order of magnitude, if not larger, than the cost of mitigation. So when you see that mitigation under the Paris Agreement is going to cost 2% of global GDP, the health benefits are the same magnitude. We should be mitigating for our health. I'm going to show 2 quick examples. This is from the US Regional Greenhouse Gas Initiative by county over a 5-year period. And shows just the benefits for child health. And you can see they range up to $21 million. And so finding ways to get this message out more strongly on the health benefits of mitigation is an area of focus for the community, because it will help with the mitigation overall. Another example I put in, mostly because I just love the photograph.
That's amazing.
Isn't that amazing? I've been using it. It's an old paper. I use it because of the photograph. It's just changing 5% of urban car trips to a bicycle in New Zealand. And you can see $200 million saved in health costs. There's huge savings in mitigation. And so making sure that we actually have the data that we can give to the policymakers to motivate action is critical. And then finally, several people asked, this is the outline of the research needs. And I will leave this up and people can ask questions about it so that I'm on time.
Thank you so much, Dr. Ebi. That was a really awesome presentation. Let's open it up in the room here. And I think Mary Ellen's going to help look at the chat, see if there's any questions in the chat. But let's entertain any questions or comments from anyone in the room. Start.
I never believe I'm 100% clear. So I'm sure somebody didn't understand something.
Well, may I start then? Just I noticed when you talk about adaptation, the time horizon for over which you're thinking about adaptation, that was maybe a century or so or less. I'm just wondering if you can talk about sea level rise and the implications of some of the locked in sea level rise projections, which are hard to imagine adaptation over the long run for. So can you just talk about that a little bit?
Sure, and people usually talk about sea level rise, which is going to go on for 1,000 years or more, and talk about small island developing states or SIDS, and think the popular conception is the SIDS are going to be overrun, right? Water is going to come up, and they're not going to be able to survive that long because many of the coral atolls have a freshwater lens underneath the island. And the sea level rise is putting more pressure on that freshwater lens, and they're getting saltwater intrusion into the freshwater lens. And so a couple of countries, Kiribati in particular, has already started making agreements with other countries, with New Zealand and with Fiji, to start moving some people off. And it's one of the areas, there's a lot of discussion in the negotiations about what's called loss and damage, because you think about losing your culture, losing where your ancestors were buried, that there is huge ethical issues around what's going to happen with the SIDS. It's also true in the Arctic, that there's communities in the Arctic that have lived in the same place for 10,000 years. Permafrost melt means they have to move. And so these significant cultural losses and how to be able to address them is an area where there's lots of ethical work going on, philosophical work going on, of how we're going to approach that. And yes, all of our immense coastline in the US is going to be affected by sea level rise. I remember the first US national assessment, we had projections of sea level rise. And in one of the climate models, about 1/3 of Florida disappeared. Going to be really significant challenges with sea level rise. And there's a nonlinear increase in storm surge with sea level rise. And that's going to affect our communities before the actual rising of the waters. I think it was Superstorm Sandy. I was talking to a colleague about some of the sillier media coverage. And somebody talking about climate change and how it couldn't possibly be affecting what's going on. It's like they continue to forget that sea level rise is the entire ocean. And yes, it's only increased a few centimeters, but it's the entire ocean. And so when you have these storm surge, you have these huge increases. Solomon Islands, their main hospital is less than a distance from me to the wall. And they're getting king tides that are flooding it already. So they're going to have to move to a hospital. So lots of changes are going to need to be made. There's going to be big changes in the next few years. I'll give you a second. And one thing I want to emphasize is we talk about change, we talk about transformation as if it's in the future. It's already happening now. And it's useful to step back and look at what the changes are that's going on now. The example I'm using all the time these days is I was in an underground parking garage, ton of cement, bringing my groceries back to the car, and it sounded like there was wind chimes. And I stopped because I was trying to figure out why would there be wind chimes in this underground parking garage? It was all the electric vehicles. The all make a tinkle at
Yes,
once.
yeah.
A whole bunch of them sounded like wind chimes. I didn't hear a single internal combustion engine. And this is what my grandson's gonna hear as he grows up. He's not gonna hear that awful noise and have those awful smells in underground parking garages. So we're already well started with the transition. And we really obviously need to push it faster.
One of the things you mentioned is the displacement or migration of folks from the islands. Do you look at migration and displacement in the work that you do? You haven't done any today, but.
I didn't, the human health chapter, chapter 7 in the IPCC report has a comprehensive review about migration conducted by some real migration experts. There's lots of drivers of migration. Nobody wants to move. Some people do, but most people don't want to move. And so it's finding ways to keep people in place for as long as possible and to figure out how to manage migration when it's absolutely necessary. And the migration we see today is unplanned. It's people don't want to do it, but they have to. War in Ukraine, 5 million people have left. They didn't want to go. So how can we think about these movements of people and make sure that we have what we need in our health systems? We have ways that we can manage and make sure that we protect people to the extent possible and find mechanisms for them to stay in place for as long as they can.
I'm always struck hearing about the IPCC, just what a massive, complex project it is.
Yeah.
Scientists around the world. So I'd be interested to hear you talk about like the logistical process.
Well, apologies to everybody. I was the executive director for one of the working groups for the fifth assessment report. So I know more than you want to know about the IPCC. Are there aspects you want to know about this?
Well, I guess I was reading recently that there's increased representation from scientists from the global south or most affected countries. So can you speak about that?
There's always, so first of all, the IPCC is an intergovernmental panel. And that means it's government. I am not a member of the IPCC. So no scientist, well, a couple of them are scientists. So a couple of the focal points are scientists, but basically scientists are not members of the IPCC. Media get this wrong all the time. So the IPCC meets every year in a panel, a plenary meeting. And they decide every now and then they think it's time to do another assessment. And when they do that, the first thing that happens is there's this 3 working groups: the climate science, impacts, adaptation, mitigation. They elect co-chairs, and there has to be 1 co-chair from a high-income country and 1 co-chair from a low and middle-income country. Big process for this. And once you have that, then there is some kind of meeting working out a preliminary outline. Chapter titles, 3 bullet points for the next assessment. The IPCC is science policy interface. So when we did the outline for our 30 chapters for working group 2 in the 5th assessment cycle, we spent 9 hours in plenary going through 30 titles, 3 bullet points. And countries put up the flag, they make an intervention, you decide if changes need to be made. If you don't think changes need to be made, you have to make the argument why not. It becomes a quite robust discussion between the scientists and the governments. And then once you have that approved outline, then there is a call for authors. Most of the high-income countries do the way they do it here in the US, where there's a federal register notice. And people can put their names forward and say, these are roles I'd like to play in these chapters. Within the US Global Change Research Program, there's then this meeting where they decide who actually to put forward. In the 4th and the 5th assessment report, I don't remember for the 3rd, 40% of authors had to be from low and middle income countries. And so this time there's 20 chapters, and you've got 20 chapters, and you've got a very large number of nominations, and you have to balance by gender, by geographic region, and by global south and global north, and make sure you've got the expertise you need. It is a massive challenge to take all of that and figure out who should be on the author teams. There are 4 meetings that every author has to attend, and The first one is where everybody introduces themselves. Most of these people haven't met each other before. You meet, you then go away and you write a zero order draft, where this goes out only to select people in the scientific community. All of the review comments are, you need to do a lot of work. You turn that around and you write your first order draft, which goes to the world's experts. Anybody can sign up to be a reviewer for the IPCC, and it's deeply appreciated. The authors have to write a written response to each and every comment. Before the special report on warming of 1.5 degrees, on average, each chapter received 1,000 review comments in each round of review. There's two. Our chapter in the special report on warming of 1.5 received 14,000 comments. Wow. Can't even read them all. The responses are really, really short. And you revise to a second order draft. The second order draft then goes back to the experts that reviewed the first and to all the world governments. And you get another thousands of review comments that you then have to address. And so there's deep engagement through all of this. Do you have time to do the panel meeting?
Well, we're over time,
Okay.
but sure. You have a reception waiting outside.
All right. So
Sure we know that.
towards the end of the process, there is a short list of authors who start writing a summary for policymakers, which synthesizes all the executive summaries of each of the chapters and really does synthesize them. And the last step of the process is this goes in front of the world governments. There's typically about 130 governments represented, and you're in a room, 300 plus people in the room, 2 huge screens, and you go word by word and line by line. Wow. And everything has to be agreed by every government. Wow. And so it's a pretty intensive process. It always improves the SPM. But you do have the input from the policymakers. And a lot of it's just frankly wordsmithing of, you know, you guys wrote it that way. What about if you write it that way? Because I could understand it that way. But you also see the governments have read the entire report, and they'll come in and say, this chapter, this page, this line number, you say X, it's important for my government. I want it in the summary for policymakers. So it's a lot of work to get that out. But when you're done, it's owned by the governments. And it's their document. And they take it back to inform their policymakers on what the latest findings are and what they're going to need to do to address them. So that's just a synopsis of, we estimate that in the 5th assessment cycle, the coordinating lead authors for a chapter spent about 9 months of their time. The lead authors spent about 6 months of their time. The review editors about 3-4 months of their time. And none of this is compensated. The world could never afford what the IPCC does. It's all of your nights, all of your weekends, your family vacations, all of it is dedicated to trying to get these reports done. So pretty massive effort. And we have one question over here.
Yeah, I did. When you pulled up the slide about the adaptation methods, so I wanted to ask, how much do you account for possibly a rebound effect on those adaptation methods? And by that I mean we talk about fuel efficiency in cars and stuff like that. So then maybe with fuel efficiency, it's cheaper, so people decide to drive instead of walk, or with insulation in certain seasons and stuff like that, maybe more where they're paying for air conditioning or so how do we account for that when
There's thousands of people doing those kinds of estimates and saying, if you implement this policy, this would be the rebound, this is what would happen with greenhouse gas emissions. So there's a whole group of people within working group 3 on mitigation who focus specifically on that and try to take that into account so that the estimates are as good as we can make them to right now, knowing that we'll improve them, but it's a good point. Thank you.
All right, well, thank you so much.